All right, here we go, guys. Welcome. My name's Sarah Cosgrove. I'm a respiratory therapist, asthma educator, and I do some tobacco treatment. I like to keep things casual. So if you're thinking of a question, ask it, okay? Don't wait till the end, no. Because if you're thinking it, I guarantee someone else is thinking it right now. So I work for the community health team from Rutland Regional Medical Center, and what we do is really getting out in the community and educating people. Our goal is working towards that preventative piece to keep people out of the emergency rooms and hospitalizations. So welcome. This is an American Lung Association presentation. We call it Asthma 101, the basics. So we're going to start from scratch and work our way right through it. I'm kind of glad they did take away my clicker because I'd be clicking and pointing with the laser and everything. So things work out. So here we go. So asthma is very common. I guarantee it's touched someone's life. 22 million people worldwide currently have asthma. Here in the Rutland region, we actually have a higher incidence of asthma than the state. So a lot of our focus is coming back to educating people in this area. 6.8 million children have asthma. Were you guys diagnosed with asthma as children? No. No. Interesting. Asthma, of course, is one of the #1 leading causes of missing school, but also parents missing work, taking care of those children. And it's the 3rd leading cause of hospitalizations of children. There are deaths related to asthma, but those are those asthma cases where people are not taking care of it at all. Hello, come on in. Yeah, we moved rooms. So have a seat here unless you want to be on film. Okay, so.
Why is asthma higher in Rutland?
That's what we're trying to figure out. The reported incidence of asthma is higher here. Air quality is one. I've heard people say that because Rutland is kind of in a valley there, that there's an inversion effect in the winter where actually the smoke is pushed down. It could also be how we're coding. So this is right now, we're really trying to figure out what's going on. I do have to say, this sheet I gave you right here, the EnviroFlash, they're in the other room, hon, I'll load you up before you leave, does air quality. And this year we actually had quite a few in the orange, unhealthy for sensitive groups. And this has been the first time that we've had this many. So honestly, we don't know right now. And we're putting a lot of efforts into finding out what's going on. So a lot of the times, people growing up that are older have heard, you know, it's a psychological illness, you know, just breathe through it, you're going to be okay. Well, the truth of the matter being that it is something physical. The airway is truly swelling and tightening up. But it can be triggered by strong emotions. And the emotions being that you're changing your breathing pattern. When you're laughing really hard, when you're crying, you start breathing through your mouth. So there is some, you know, 2 strong emotions triggering asthma. The other one, asthma is an acute disease. You can outgrow it. Did you ever hear? Well, you'll outgrow your asthma or things along those lines. No. If you have asthma, you have it your whole life. But you may have control over it as some aspects of it more than others. We see a lot of uncontrolled asthma while children are young. And then we see it when people are older, when their lungs are starting, you know, to show the wear and tear of just growing older. So if you have asthma, you have it through your life. And asthma is curable. If anyone tells you they have a cure for asthma, look twice at them. It is controllable. It is not curable. So once again, you're going to have it your whole life. But we can control it to the point that no one even knows you have asthma. So actually, I believe the percentage was like 23% of the Winter Olympians had one form of asthma. But you would never guess because they've got such control over it. You gonna be an Olympian? No. So asthma limits normal activities. Remember gym class with the kids that had asthma would sit on the side and stuff? No, no. There's medications, if taken daily, that can make it so people can be as active as everyone else. No slowing down whatsoever. I got a few more of these and we're done. Oh, asthma medication inhalers are addictive. Have you ever heard the steroids in the inhalers are addictive? No. Not the same type of steroids. These are steroids that strengthen your lungs. They're not the addictive bodybuilder ones, all right? Completely different, working on different mechanisms in the body. And one more, asthma limits a person's ability to fully participate in sports. And we know that's not true. Well-controlled asthma should not limit anyone's activity. So I'm going to go through. So how do you know your asthma is not in control? This is a little respiratory trick we have. Do you take your rescue inhaler more than 2 times a week? Do you wake at night more than 2 times a month with asthma symptoms? The shortness of breath, the wheezing, that darn nighttime cough? Do you refill your rescue inhaler more than 2 times a year? No? Well, those are good indicators for it. You know, just a basic to help us gauge if your asthma is in control or not. So here we go. These are the ones that I needed my slides for because I wasn't going to draw you pictures. Asthma is a chronic inflammation disorder of the airways. What does that mean? That asthma is something you're going to have your whole life, and it's an inflammation. It means a swelling of the airways. Bronchoconstriction, which is the tightening of the muscles around the airways. Something triggers it where the muscles tighten around your airways and cause it to start closing up. And as it tightens, it squeezes mucus out into the airways. So let's put that together with a picture. So right here, your airway really starts right here with your nose, goes down to your throat and branches out into your lungs. Airways in children are as thin as a piece of hair. So think how much air is getting through that. So with that tightening and mucus, that can really obstruct someone's breathing. So asthma is happening down here in these little tiny airways. So ideally, you know, a nice healthy, this is where I needed my pointer, I'm blind. Nice healthy airway should be nice and open. Well, do you see the swelling with the asthmatic airway? Right there. So a nice airway that was open like this is now getting smaller and smaller. And then that mucus is starting to get in the airway.
Does that matter on, like, if you only have mild asthma or severe asthma?
So does it matter based on the severity?
Yes.
This is the basic mechanism of how asthma occurs. So everyone's asthma is going to be a little bit different, but this is the basic of what's going on. So I guess a good way to look at it is how often asthma happens. Asthma attacks and stuff is going to hinder someone, or is going to really define someone's severity. Does that make sense? So this is going to be happening to anyone with asthma in the same general area, but some of us it happens more. Some of us it happens more severe and quick. So as those muscles tighten, I've got a better one here. They squeeze that mucus out into that airway. So you know how it's easy to get that breath in, but it's getting that breath back out is that hard part. And that's where you start hearing the wheeze, is the air coming back through this messy airway and through all that mucus. Does that make sense? Yeah. So that's like that tightness feeling you're having, or you know, the whistly breathing, the cough. That's all associated right there with that airway tightening. So, how do you get an asthma diagnosis? Your assessment of symptoms. You go to the doctors and I'm having a hard time breathing. I feel chest tightness. My exercise, I can barely exercise anymore. Those can help start putting your case together towards that diagnosis of asthma. Medical history. Do you have family members that have asthma?
Yes.
Yeah, that makes a huge difference. Do you have a question? Oh, I'm sorry. Physical exam. You know, have you had the breathing test, pulmonary function test?
Yes, I have.
The breathe in, blah, 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 blah. Well, that assesses how much air you can get and how fast you can get it out. And that tells us, you know, if someone has asthma and the severity of it. So all of those combined is really how we get that diagnosis of asthma. So the thing about asthma is it never just happens out of the blue. There's always something leading up to it, some kind of symptoms giving us an idea of what's going on. So an early warning sign may include a drop in peak flow meter readings. Do any of you use the peak flows? It's kind of like that spirometry test. Take a deep breath and see how much you can get out. And this helps us gauge and values of how much air you're getting out. So you can recognize if, say, I'm always blowing a 400 and I'm just not feeling right and I'm blowing a 200 now. And it helps us communicate to the doctors in an effective language where you can communicate that, because me saying I'm a little short of breath could be completely different than you being a little short of breath.
So should you be given one of those when you're diagnosed?
Should you be giving a peak flow meter when you're diagnosed? Yes, we suggest that for people that aren't having a good time or having difficulty gauging when asthma symptoms are occurring. It is very handy, especially with children and starting to relate their symptoms and how they're feeling to their asthma, so we could start working on self-management and having that language piece to it. Because a kid saying, oh, I don't feel right, you know, what's going on? Oh, my chest feels tightness. So it helps us kind of start putting a language to it. And doctors speak in this numerical value. They'll know if you're, okay, I usually blow a 400, I'm blowing a 200. They'll understand that a lot better than, hey, I'm kind of short of breath today. It's worse than it was yesterday. So this is a good tool to help gauge where you are. So when we say a drop in peak flow meters, that's a good indicator. And that could start happening a week before you really start having full-blown asthma symptoms.
Mm-hmm. So can you just get those at the drugstore?
You can. You can get them at the drugstore. You can get them at a prescription written by your doctor where insurance would cover them as well. And there's several different models, and I'll show you a little bit later some of the other ones. So another one is an itchy chin or neck. A child coming and itching like that, or I have people say that, you know, it just feels like there's like an itchiness inside their throat, or like wanting to itch their throat with their tongue. Something's going on. Their changes are occurring right inside them. Kids can't really put that language to what's going on. We call it red beard. You got a kid that's coming and they've got the red spots all through here because they've been digging away. That's a good early indicator. Another one is that clipped speech. And this is anyone. I'm having a hard time breathing. Oh yes, you're going to sit down. We're going to get you your inhaler. So that's a good early warning sign. Itchy, watery eyes. A lot of the time, yeah, do you get the itchy, watery eyes? Yeah, that's a good early indicator. Also, dark circles under the eyes. Why do you think that is?
Probably with the asthma.
With the allergies, with asthma, but also if you've got nighttime symptoms, and you're waking up all the time, are you sleeping well?
Not always.
No. So those.
I have an air purifier.
You have an air purifier too?
At home to take the dust particles out.
Those help out a lot, don't they?
Yes.
Yeah. So sleeping at night, if someone's not getting good quality sleep because they're being woke up throughout the night, they're going to have those dark circles and be not feeling that well. So that's a good early indicator. Runny nose or sneezing. That postnasal drip. Yeah, I got some faces. Exactly. You know, the nose starts running. Can be related to allergies too, but it's dripping down the back of your throat too. And you feel that tickle and you want to clear your throat. The lungs don't like the postnasal drip going down your throat, so they want to tighten to protect, and there's your asthma cycle starting. Another one people don't think about is hunched shoulders. I was watching a little kid at a birthday party last week, and he's walking around like this, and they're all picking on me. Oh, you're walking like an old man. And I stopped. I'm like, he has asthma, doesn't he? Yeah, little guy. It's like this, and he's trying to pull in extra pressures to get that deep breath, and it's just a posture that occurs. So if you know a little one that's got asthma, and you just see them, they're walking around, they're having a hard time, make that asthma cue right there in your head. If you see someone leaning over like this to get the breath in, that's another one. People are trying to pull in those extra pressures to get that breath in. Now this last one, a change in mood and irritability. That's always gets parents of teenagers that have asthma. How do you gauge that? I trust parents and grandparents, you know, people that are around the kids the most, but if you're seeing something that's uncharacteristic, like the kid's just crankier than usual, just not acting like themselves, right in your head, what's going on here? You know, is it related to the asthma? So these are all warning signs that give us the cues that something's going on. There's some changes happening inside. Do you guys have any questions about these? No? Do you recognize some of them? Yeah? So symptoms of asthma. This is telling us that the asthma is already happening. Wheezing, that noisy breathing. And that's that air trying to get through those tightened airways with mucus in it. Anyone get the wheezing? That's usually the most common one people report. Now, some people get all these symptoms. Other people get one here or there. Some people, asthma attack to asthma attack, it changes. So, another one, that cough, that dry cough, especially at nighttime, where you feel like there's something you want to move in there, it just doesn't go anywhere. That's a symptom. Difficulty breathing or shortness of breath. Well, you just can't get that deep breath in. That's a scary feeling. Tight chest or chest pain. Does anyone get that one? Where it really feels like someone's squeezing you from both sides? Yeah. Little kids report, like, I go up and I'm like, does it feel like this? And I'll put my hands on both sides and squeeze. And I'll be like, yeah, that's exactly what it feels like, that tightness in their chest. And then the final one is retractions. And that is an emergency situation. And what a retraction is when someone's trying to pull in their breath. They're having a really hard time breathing. They're trying to use all their muscles they can to get a deep breath in, and you'll see it suck in, usually around the collarbone and ribs. And you see it more in little kids, but that's where you give them their inhalers. You're calling the doctors. So retractions are where it's sucking in, there, and between the ribs. And you'll see those little ribs clearly defined too, using every muscle to pull in that breath. Any questions on those? No? You recognize them, don't you?
How do you know if asthma, if it's you're difficult breathing, if you're exercising, if it's asthma, or if you're just out of shape? Basically.
That's a good one. If you can sit down, and you can recoup yourself,
How quickly?
I would say within 5-10 minutes. Oh, I'm sorry. How do you know it's asthma and you're not just out of shape? Is that a good rephrasing of it? If you can sit down and you can recoup yourself, where you sit and you can breathe and it's getting easier. If you're still feeling those little shallow breaths, then it is asthma. Now, there's also exercise-induced asthma, which is your breathing. Exercise breathe, you start sucking more through your mouth, and I'll go over exercise-induced for a moment. And that can actually trigger an asthma attack. And some people only truly have that exercise-induced aspect of it. Also, exercise can trigger your asthma. So, you know which one it is. If you can recoup yourself, then it's out of shape. But if you're really feeling it and you're starting to experience more of the symptoms, then it's an asthma attack. Is that? Thank you. So what are we looking for? And this is adults and children. Anxious or scared look. Yeah, it's pretty scary when you can't catch that breath. Unusual paleness. That can be sometimes an early warning sign too, where you look at someone and they're just pale or sweating. That's another one. Flared nostrils. Trying to pull in those breaths as much as possible. And pursed lip breathing. And this is pursed lip breathing. This is a trick that asthmatics and COPDs start doing. And it's where they're breathing through their nose. Trying to catch their breath that way. And the idea behind that is your nose warms and humidifies your air. And by breathing through your mouth, it's holding the lungs open a little bit longer to get that deep breath in. And some people learn that skill early on. It helps. It's not a cure for it or a fix for it, but it does help. Fast breathing, shortness of breath. You can get those breaths in. It's just harder to get those breaths back out. Hunched over body position. Just feeling like you can't get it in, you're leaning in. That's also that hunched. You're using all these extra muscles to try to pull that breath in. And it just happens unconsciously that people revert to that. Perspiring, start sweating up a storm. Have you ever had an asthma attack where you just start sweating? No? Yeah. Vomiting due to hyperventilation. See that in a lot of kids in exercise-induced. they start breathing like that, and it starts making them sick. Restlessness during sleep. Someone that just can't sleep through the night, tossing and turning, coughing at night, that shortness of breath. You're not getting that good quality sleep. And the fatigue that's not related to activity, well, you're not sleeping at night, but it takes an awful lot out of you when you're having an asthma attack and your body's just not working at that peak performance. Any questions? So, this goes back to your question you had in the beginning about the severity. There's many different severities of asthma. Some people could just have the exercise-induced kind. Others, you know, they have an asthma attack every now and then, mostly allergy season. And then there's some poor people that just have chronic severe asthma. And so based on people's severity really dictates what kind of medication we're going to give them, what their treatment plan is, and how often they need that medication and at what dose. So how severe your asthma is dictates what type of medication you're on. So some people are on controller medications that they take every day. Some people only need their rescue inhaler every now and then. So everyone with asthma is different. That's reassuring, but not in the same breath, right? Triggers. Triggers are the things that make your asthma begin to get worse. What triggers do you know that you have?
Pollens.
Pollens. You have allergies, huh?
And dust.
Yeah, dust.
Around things that are moldy.
Mold. Yeah, pets. Infections. Cold and flu.
Cold weather.
Cold change in weather, huh?
Yeah.
It's really cold out.
Yep. Yep.
It's hard if you do anything at all.
Yep. So infections, cold and flu, those can make your asthma worse.
Yeah.
Allergies. Allergies could be any of the things we listed there. Okay, let's go with pollens, grasses, molds, dogs, cats, foods, all of them. Have you had allergy testing? Yeah. Allergy testing is very good, especially with the kids. Usually over 5 years old, they do the allergy testing because you can't get a good reading under 5. But it really helps start teaching them those self-management skills. You know what the allergens are. We teach them to stay away from those allergens. Irritants. If you can smell it, you are breathing it. So those strong smells. The paint fumes, perfumes, candles, air fresheners, cigarette smoke. Cigarette smoke is a huge one. Secondhand smoke. If you can smell it, you can breathe it. So what I try teaching people is if you're smelling something and it's irritating you, to get out of there, to go somewhere where you're no longer smelling it. I also have to say air fresheners like Febreze. You spray that in the air and you see those tiny droplets. Well, that's what we breathe in, and it can irritate a lot of people with asthma who have sensitive lungs. But also those tiny particles stay in the air a lot longer than we're actually visually seeing them.
I noticed Febreze, I think it's Febreze, this came out with this, supposed to be anti-allergen spray.
Yes.
Think about that?
The anti-allergen Febreze spray.
Is that just another label in the same product?
Yeah, I would say so, because it's those tiny particles in the air that are actually irritating the airways. I'm sure you know there's some purpose behind that, but it's the tiny particles that people are breathing in. So I would say stay away from it. Vanilla perfume, too, is one that people have complained really irritates the airways as well. So irritants, any strong smell. Also cold weather, like you said, the humid and cold weather. You go outside, you take that deep breath, and it goes right to the lungs. Times, I'll even throw in change of weather then too. April, we say tax week is a bad one here in Vermont, and fair week. Those are 2 weeks where we have a lot of change in weather and a lot of asthma symptoms occurring at that time. And then that last one's that behaviors. The laughing, the playing, the crying, the excitement, the anxiety. When people are experiencing those behaviors, they start breathing through their mouth instead of through that nose. The nose warms, humidifies, and filters. When we're breathing through our mouth, the air is unfiltered, but it's also cold, and it takes some moisture away from the lungs. The airways want to protect themselves when we're mouth breathing, and they tighten up. So if you're feeling a little anxious and you can feel your airways start tightening up, or even laughing and you can start feeling it, start breathing through the nose. Warm humidified air, or even, pulling something over your mouth while you're doing, just to get that warm air in there. A lot of exercising outdoors in that cold weather, or even going to your car. You can have like a fancy scarf or something over your mouth so your air is warm that you're breathing. It will be much more acceptable. Any questions? No? Small groups are quiet, right? So if you can avoid your asthma triggers, you can prevent a lot of the asthma episodes and require less medication. People that love their pets, and I would never tell you to get rid of your pets, but if you're allergic to your pet, it sleeps in your bed at night, and you need to take a lot of medication, it's kind of one of those things that looking at your quality of life, Do you want to live taking this much medication, or, look at keeping Fluffy out of your bedroom? That's a huge one. Keeping those pets out of your bedroom at night is going to make a world of difference. But if you're allergic to pets, it's one of those ones where you really have to have that family talk and gauge, more medication or exposure to the pet. And that's a hard one. That's a hard one for everyone. So those are the triggers that we just spoke about right there. Luckily, being here in Vermont, we don't really have that much of a cockroach problem, nor do we have a smog problem, thank goodness. But these are all potential triggers. So knowing your triggers and learning to avoid them is going to help out considerably.
What are roaches?
It's the droppings.
Oh, no.
Yeah, the excrements, yeah, they're dirty creatures. Also mice. It's the mice urine and droppings that actually trigger asthma attacks. Yes. I saw my first cockroach in Vermont last summer, and I guess I had a completely different picture of what they were. They're nasty, ugly things. So those allergens. The animals, the cats, dogs, birds, and mice. Well, also with pets, their fur can collect pollen and dust. So you may not be allergic to the pet, you could be allergic to what they're bringing in. So, taking a wet paper towel when your pet comes in and actually wiping their fur down like that might help. Washing hands after playing or touching the pet, because you pet the pet, then all over your face, or can trigger asthma attacks in that manner. So a lot of it's what's collecting on their fur. Another one is dust mites. Carpets in the bedroom. That's a big one. Also, stuffed animals on the beds for kids that collect dust. That's another one we see a lot. So having the children, or even us adults, one pillow on the bed, pillow covers over them, one stuffed animal on the bed for kids. Sometimes that's hard. And if you have children that have dust allergies, you can take those stuffed animals, put them in a plastic bag and stick them in the freezer, and that will kill the dust mites. Or,
really?
Yeah, or we're lucky enough in Vermont that a good part of our year we can just take it outside and hang it on the clothesline, and that will kill a lot of the dust mites. Another one with those dust mites is a mattress cover. Do any of you have the mattress covers on your beds? Oh, that helps out considerably, or over in the ones that go over your pillows as well. I think we spend a lot of our time, hopefully 8 hours, sleeping. Direct contact with that bed, a lot of dust and dander in the bed. So by adding the pillowcase encasements and the mattress covers, helps out a lot, so you're not having that direct contact in your face all night. Another one, mold. Whether it's the mold in the bathroom, the mold from rotting leaves or debris in the yard, those are all molds that can irritate people. Pollens, weeds, grass, trees. They're important to know which pollens that you're allergic to too, so you could start treating yourself with an allergy medicine to help out. If you're not sure what your particular pollen or allergen is, if you have a calendar and you mark in the corner like a little star or something when you start having symptoms, You can always go back and check and find out which pollens occur during that time and start tracking it in that manner. Another one that people don't think about is food allergies. I'm seeing this in a lot of kids. Lactose allergies, soy allergies, even gluten, and it's affecting their asthma.
It's like sulfites.
Sulfites.
Drinks with sulfites.
Yeah, wines and...
Yeah, it's like, why does it always happen when I drink? Oh, okay.
That's an aha moment.
Yeah.
Sulfites, she said. Why does sulfites happen? Sulfites are found in wines and such, and that can be a trigger for some people. They have low sulfites wines. They are hard to find. And then there's other medical conditions that contribute to asthma. If someone has cystic fibrosis or COPD, those are diseases that actually affect as well. And latex allergies. So allergy testing helps out a lot, but tracking your symptoms on a calendar will help you too if you're concerned that it's pollens and weeds and stuff. Because by tracking it too, different pollens have certain times of the day that they actually bloom and come out that you can gauge. You know, grasses, I believe, are like the early morning, afternoon hours. So by knowing these and not going outside of that time, or just being aware that you're going to be more sensitive at that time, really helps control as well. Infections. And these are all pictures of children I wanted to throw everywhere. Teaching the kids to cough into their elbows. That's a big one, because the cough on their hands, they get rub it on everything. If you catch a cold and you've got sensitive lungs, it will stay with you longer. And it could be more severe than, I'm sorry to be looking right at you the whole time, or more severe than people that don't have asthma. So avoiding people that have illnesses, teaching children around you to cough into their elbows and wash their hands frequently. That bathroom towel, families, how nasty is that bathroom towel sometimes? So changing that out, the one that everyone dries their hand on, changing it out nightly. Some people actually have different towels for different members of the family. So that's a big one. And getting the flu shot, that helps out a whole lot. Irritants, cigarette smoke. I left some information out there for the free quit smoking services. So if you live with a smoker, or you are a smoker, reducing contact with cigarette smoke will help out considerably. There's free programs that offer phone counseling, groups, free nicotine replacement. So there are services to help you. But I would say I see tobacco use impacting the majority of asthmatics I have, whether it be first-hand, second-hand, or even third-hand, which is the smoke that clings to our clothes. Huge contributor to uncontrolled asthma symptoms. Dust and chalk, we don't really see that much of it anymore. But strong odors. The perfumes, the strong scents, the air fresheners, cleaning products, chemicals, paint. Those are all things to avoid. They do have low odor cleaning products. And if anyone's interested, I have a sheet of low odor, safe, green products that you can use, or just alternatives to cleaning products that we suggest for people that have asthma. So stick around afterwards. Another one is cold or really humid air. And that was what we were talking about, is that cold air on the airway. Breathe in through your mouth. The airways want to protect the lungs, so they tighten right up. So wearing a scarf over your mouth. They have special fancy neck gaiters, we call them. Even pulling your shirt up over your mouth helps out a whole lot, because that air you're breathing is warm and much more acceptable to the lungs.
What about dry air?
What about dry air? Dry air can do it too, yes. But it's also that breathing through your mouthpiece. So if you really are going somewhere and it's just, you can feel it. You're feeling that tightness in your chest. Try to revert to the nose breathing, because your nose warms, humidifies, and filters, and it's so much more accepting to the lungs. I don't see as much here in Vermont, of course, with that dry air, but adding a humidifier sometimes helps out a whole lot. A cool mist humidifier. Okay, none of that hot air humidifiers that we used to use, because you never can really clean them out 100%. And the concern is the warm moisture can create mold as well. And you don't want to be putting mold or particles into the air or making the air too humid, which is also not good as well. Think of those really, really hot summer days where you go outside and you just feel it. That's that hot air humidifier as well.
I find I use a fan at night because if the air's too dry, I can't breathe right.
Yeah.
So I just turn a fan on.
Do you have an air conditioner in your room by any chance?
I do in the summer months.
In the summer months, yeah, you like the air circulating.
Yeah.
Yeah.
And I breathe much better with the fan going.
Yeah.
I sometimes have the window open a little.
So she's asking about the fan. I prefer air conditioners, but the circulating air helps you. That's good. With the fan, you got to think it stirs up a lot of dust too. So if you have an option between the two, the air conditioner would be your best choice.
Yeah.
But you know, I'm not going to tell you no. Do you have COPD as well?
Yes, I do.
Yeah. So I know a lot of people with COPD like to have that airflow on their face while they're sleeping.
Yeah.
Do you raise your head of the bed at night?
Yes.
Yeah, that helps out a whole lot. Another irritant people don't think about is acid reflux. That irritates there. Raising the head of the bed 5-6 inches at night definitely helps out with that. But that acidic stuff coming up does irritate the airways. So knowing that, sometimes taking reflux medication will help. And a lot of people, once they control that reflux, their asthma gets better too. So yeah. Any questions on this? It's good stuff. So that's that behavior piece. The crying, the laughing, the shouting, you start sucking through your mouth and having those little shallow breaths. Exercise, breathing through your mouth too, a lot of running, going like this. So teaching people to do that, breathe in through the nose, that athletic breathing helps out a lot. And then that darn smoking, going back to that. Any questions on the behavioral piece of it? No? So that's that exercise-induced asthma. You may hear it called exercise-induced bronchospasm. And the bronchospasm is the tightening of the muscles around the airway. And that's very reversible. A lot of people that have exercise-induced asthma have an inhaler. And they are taught to take that inhaler 15 minutes before activity. Why 15 minutes? Because that's how long the medication takes to get in your body and really open up those airways. Do you use it before activity?
Well, I was told to half an hour before.
Half an hour?
Yeah.
Yeah.
See, I was just told I had mild asthma, given an inhaler, and said use it before exercising if you need it and when needed, and that was it. So I don't really know.
Do you have a spacer as well?
I do.
Good, good. 15 minutes before, because then that allows you to open up the airways. 30 minutes is fine. The medication really lasts like into your body up to like 5 hours. So it's in there. You don't want to be taking it puff, puff, and running right out to activity. You want to give it time to really work in your system, to open up the airways so you can get exercise without the airways tightening up and all the symptoms associated with it. So with exercise-induced asthma, it's a lot of that breathing. And you're breathing shallow, and the airways are tightening up. So some sports affect it more than others, but this is a really good, more depth than we need to. But the intense breathing during exertion causes water loss from the lungs, which cools the lungs' moist lining. Drop in temperature results in the constriction of muscles around the airways and the inflammation. What is that saying? Your lungs do not like you breathing through your mouth like that, so they will tighten up, and the asthma symptoms occur then. So by taking your inhaler, it causes those muscles to loosen up so you can still get airway through. Rescue inhaler, relieve inhaler, all the same thing. So symptoms of exercise asthma or bronchospasm, short exercise endurance. You know, you're watching a bunch of, you know, you're catching pain or tightness with exercise. That's the one a lot of people say. Do you have that where it just feels like you're being squeezed? Fatigue? Upset stomach and cramps. You hear that in a lot of girls, you know, that are playing soccer with asthma, that they just tighten right up with difficulty breathing. Sore throats, headaches, and just difficulty keeping up. Doesn't sound like fun. A lot of the times these symptoms will cause people to not want to exercise, which then starts that cycle of being out of shape. Am I out of shape or am I having an asthma attack? And it's hard to really tell the difference. So pre-medicating 15, 20 minutes before activity really helps out a whole lot.
No matter what type of activity? Or?
Well, with kids, you know, giving it before them or before any type really helps. You know they're going to go playing soccer or bike riding. You know, something active like that. If you start feeling the symptoms and, you know, every time you go for a walk, you start feeling it, in my head, I would say, yeah, I would give it to you. And there's different sports that affect people differently. Some of them being here. I think that's the next slide. Oh, not yet. So conditions and actions to take. Extremely cold temperatures. If you know you're going to have a hard time with it, I would just avoid exercising outdoors on those really, really cold days. If possible, cover your mouth and your nose with a scarf or mask, a little bandana. High pollen count days. Exercise indoors or avoid exercise during the mid-morning hours. As I said, the EnviroFlash sheet gives you a good indicator of when the air quality is bad, and this is for all over the nation. You type in the zip code, and it gives you a good idea of days that are ones that you probably don't want to be outside exercising. Newspapers can give that information, the Weather Channel. It's all great information to know ahead of time. Heavy air pollution. We're very, very lucky here in Vermont. But avoid that midday exercise on days when the ozone's high, but pollution is going to be worse when it's the hottest point of the day. So it would be like the noon times around then. So avoid then. And if you have a cold or a sickness, take it easy, because you're going to be that much more sensitive to having an asthma attack if you're already sick. So take it easy. Don't push your body. Do what you can do. Any questions? Okay, so these are the activities that affect asthma the most. The cross-country skiing, the hockey, speed skating, basketball, soccer, cycling, running, things that you're going. Those are the ones that we see a lot of, you know, the most symptoms with. So those would be the ones that I would treat beforehand with the asthma and give that time span. I remember being young and watching the boys on the hockey bench, puff, puff, right out on the ice. No. You want to give it time to really work, because it can process through your body too fast and you wouldn't get the benefits of it if you don't really give it the proper time to work in your body. Ones that you know are here and there that affect people's breathing: swimming, playground activities, hiking, but also with swimming, a lot of the times it's those strong chemicals. And you said like the sulfates and sulfurs and such, that can irritate people's asthma. So strong smells in enclosed pools can be very irritating. Playground activities. Kids are wild and they do not stop. So some kids do need their inhaler before they go out. And then hiking, you're out in nature, so there's a bunch of factors that can irritate your breathing as well. And then mild ones: baseball, football, martial arts, golf, you know, the activity where you're taking time and pausing. So those aren't as high risk, but you know, some people are more sensitive and have different severities, but I'm not so much worried about these activities here. So if you have children with asthma, talk to your healthcare provider or even yourselves about that pre-medicating before play. And also carrying the rescue medication with you is going to make a world of difference, because if it's sitting on your kitchen counter at home, it's not going to help you when you're running up the street and you have an asthma attack. So carrying it with you is very important. And communicating when a child has asthma to whoever's caring for that child what to do in these situations is very important. And then an asthma action plan. Do you guys have an asthma action plan? No? An asthma action plan is one of these sheets right here. And it's a form created by your doctor, and it actually tells you, It puts it in 3 zones. You got the green zone, the yellow zone, the red zone. The green zone tells you what medication to take and how often. So if your breathing's good, you've got no cough or wheeze, so you can sleep through the night, you can work and play. Well, what medication do you take then? Often people who need a controller medication, it's right in there. The next one is yellow, starts telling us you're having asthma symptoms. First sign of a cold or mild wheeze, tight chest, coughing at night, take this medication and how often you take it. And then red, medication's not helping. You're very short of breath. You can't talk. You have the same or worse symptoms after 24 hours. It says this could be life-threatening. Take this medication, then do this. So a lot of people that are new to having the diagnosis of asthma or teaching kids what to do in these situations, this helps. This is a great communication tool too, from the doctor's office to home to daycare to the coaches. Gets everyone on the same consistent page. So that was what we were talking about right there. Playing it safe with exercise-induced asthma, pre-medicate, warm up. Always give yourself that time to get your body going. Don't just throw yourself right into activities. Do the activity and always have that warm down period too. Just walk, taking it slow. But stop exercise if you're having symptoms. And that's that integrating it into children too. You're starting to feel it, you're having a hard time. Stop the activity, don't make it worse. And have that inhaler available. It sounds simple, but if one piece of that's not working together, it can be a very dangerous situation. So asthma medications. How many of you are on a controller medication like Flovent, Dolera? None? Are you on a Flovent?
I have the Spiriva.
You have the Spiriva.
Asthma-Nex, and there's one other one.
Yeah, medications that you take daily, right? Yeah. So asthma controller medications help the inflammation of your airway. They're taken daily. They're not like you're going to be like, wow, I feel so much better. How people realize they're working is one day they're like, whoa, I haven't had asthma symptoms in a while. You okay, hon?
Yeah, I'm okay.
It's about that. They realize that they're not having as many asthma symptoms. It does not mean that you don't need your quick inhaler, but you need it a whole lot less when you're having asthma symptoms. You okay? Say the word. And then there's that quick relief medication. Inhaled bronchodilators, the Xopanexes, the albuterol, the Pro-Air. Those are the quick relief medications. They're fast acting. When that airways tighten up, they cause the muscles to relax, to open up so we can breathe better. And they relieve symptoms during an asthma episode. Do you have your inhaler? We'll demonstrate. So back to what I was saying there. It's relaxing the airways. There's a peace of mind to that where you start feeling that medication work. What I want to emphasize about this is taking it when the symptoms first appear. Think of when you have a headache. If you have a headache and you take the aspirin right away, it helps with the headache. But if you let it go and you have a horrible headache and you take that aspirin, it's not going to work, is it? No. So it's the same idea. When the symptoms, the wheeze, the chest tightness, the difficulty breathing, when those start, that's when you take the medication. You don't let it keep getting worse or it's not going to be as effective. And then that controller medication, what it's doing is really decreasing the swelling in the airways. It controls symptoms, prevents future asthma attacks. It's important to take it as directed. I come across people all the time, yeah, I've got Flovent, I take it when I need it. Well, you've got horribly uncontrolled asthma. How is it prescribed to you? Well, take it every day, but I'm feeling great. It's important to take it as directed. It's strengthening up the lungs, making the lungs stronger. So you should be having less asthma symptoms. And that's how we really start getting that control of the asthma. Any questions about medication? No? With these controller medications too, it's important to rinse your mouth out afterwards. Okay, so that's the gargle, gargle, spit, not the gargle and swallow it, because you can develop thrush in your mouth. And thrush can be quite painful. So it's important to rinse that mouth out and spit it out so you're not swallowing any of that.
Just with
With the control, I say with both, quite honestly, anything you're spraying in your mouth, really. But more so with the controller medication because of the steroid that's in it can cause thrush. And also, with inhalers, using a spacer makes a world of difference. When you're using an inhaler and you're just puffing it into your mouth, the majority of that medication stays in your mouth. I've heard that in some reports that you only get 1/3 of your medication when you're just directly puffing it into your mouth. It can cause tooth decay as well because it will stay in your mouth. And it's not having a chance to get down into the lungs. Now with a spacer, it's creating a little space in between your face and the medication, but the medication stays right in here. So when you take your deep breath, it goes into your lungs with that breath, and it's going, all the medication's going right to where you need it versus staying in the tissues of your mouth. So a spacer helps out so much, and it gets the medication to where it has to go. Also, these have anti-static on them. So what it means is the medication's not sticking inside the tube. It's going to be floating right around in there. And it's important to I say every 6 months to get a new one of these spacers because that static after a while starts wearing down. Any questions about the medication? Not at all. You guys are easy. I love it. How are we doing time-wise there? All right, 7 o'clock. So we are almost done. Medications have expiration dates on them. Medications expire and become less effective. So by checking to see how old your medication is very important. So as medications get older, they become less effective. There's also gauges on medications that tell us how many are left now. So the days of dropping it in a cup to see if it floats, no, those are over. Don't do it. And the counter also helps because once upon a time people would have a piece of tape and they'd have to put hash marks on it to see how many times they've used it. So the majority of medications have one. Do you have an inhaler with a clock on the back?
No.
Or you were checking the expiration date.
Expiration date because I don't use it that way.
Yeah. So, and that happens too when you're not using it that often. You don't see it, and you have to take it apart to usually see too.
I've just been looking around every single month, so I thought I didn't realize it.
It's interesting. The things we learn. So with a spacer and a holder chamber, hold on, let me try that. Spacer with a holding chamber. Shake the medication. You put it in here, puff it, blow all your breath out. 5, 4, 3, 2, 1. Like you're blowing on soup.
You don't spray it when it's in your mouth?
No, it's staying right in here. If I sprayed it and walked around, and did things, then it wouldn't really be as bad, but it's staying right in there. If I breathe on it and I go, and of course I take the one that doesn't make the noise right there, but if you breathe in through it, the spacer, and it makes a squeaking noise or a whistling noise, you're doing it way too fast. You want to have a nice controlled breath in. Then you hold it, and then I say blow like you're blowing on soup. So you're slowly breathing out. Spacers make a world of difference in medication. I like the spacer. Any questions? So that's the anti-static, is so why you don't have to do it in that manner. With little kids, they take 6 breaths. Once with the mask, they can just keep breathing it like that, and the medication's going to stay right in there. Do you have a question, hon? No. And that would be the little guys right there. The masks fit right on their face. Put the mask on their face, you puff it, and you have them take 6 breaths. Nebulizer. You have nebulizers? No? Nebulizer is a machine. And what it does is you have little tubes of your medication and you squirt it right in here, plug it into the machine, and you'll start seeing steam coming out. There's either a mask or a mouthpiece. Breathe on it. Some people like it. It's nice and soothing on the airways. But it's usually the same medication as you would get in your inhaler. It's just a different delivery device. It's very important to replace these pieces and also clean them out in soap and water. It's very important because if you've got all kinds of goo and yucky medicine, you're going to be breathing it in time and time again. So washing these pieces, don't do it in the bathroom because it's wet and humid. Soap and water, put it on a paper towel, kitchen counter, bedroom desk or something, and you can just let them dry in that manner.
With the spacer as well?
With the spacer, I wouldn't rinse it out just because of that static piece, but I would always wash the mouthpiece out and wipe that out. These are plastic and they can be quite expensive. With co-pays, they can range all over the place. And water, you know, can ruin the static, but if people put them in the dishwasher, which I've seen will melt them. So being gentle with them is important. Peak flow meter, we talked about that earlier. Peak flow meter, you tap it down. It's measuring how fast we can get the air out of our lungs and if our symptoms are changing. Take a deep breath. Shoot it out. Easy as that. Gives us our reading. Takes about a week to really find your personal healthy numbers. And that is by doing 3 breaths in the morning. You write them down on this sheet, which is in the other room. And you track the symptoms over a week, and that's how you get your baseline. It's important to do it while you're healthy, though. So this is for people that are poor perceivers of their symptoms. And it's also teaching children self-management skills, relating their symptoms to how their lungs are functioning. So it's a self-management tool, and you can ask for a prescription. You can buy them at a drugstore. And I just showed you how I did it. There's many different forms of the peak flow meter. So it's also important to read the directions that come with each one, because it's going to vary from device to device. Some are flat, like the one the boy is using here. There's many different styles, but to always use the directions provided.
Is there bigger ones too?
Oh, there's all kinds of ones. Yes, all kinds of them. So what is peak? It makes you aware of changes in breathing. Catch those breathing problems early. Helps identify when to take medication, because that action plan is also built off that. And it's a good language that doctors understand. They understand these values. So me calling, saying I'm short of breath is maybe different than you, maybe different than you. But if you give them the values, oh, they'll know exactly what you're talking about. So it's a very helpful tool. So if someone's having an asthma attack, what do? We remain calm. Reassure them they're going to be okay. We stop what they're doing and remove them from those triggers. We get their medication. When can you go back to doing your activity? When the wheezing stops, when there's no chest tightness, no shortness of breath. You can talk in a complete sentence. Grandma, a trick? Hey, what do you want for your birthday? Kids will come right out with it. They can speak in one clear sentence. They're fine, then go back to play. If they're still, sit down a little bit longer. I'm going to watch you. If a person's able to walk around freely, they're not hunched over, they can keep a normal pace, they're fine. And going back to that peak flow value, if they're up to 80% of their predicted value, they're fine. They can go back to what they were doing. We want you to be able to sleep through the night, have the best quality of life you can. We don't want you coughing or wheezing during the day. We want you to be physically active, not missing school or work due to asthma, to not have emergency-related visits. Those are very important. So that is pretty much my presentation. What questions do you guys have, or just comments? You have to remind me to repeat it too. None?
I came basically because I'm not really sure if I'm having an asthma symptom or not.
So you're not really sure of your asthma symptoms. That's a repeating piece. Do you feel that you got a little bit more information in regards to this? If you are interested, I can give you more information after that. There's other resources here at the hospital. We have a pulmonary function lab. We have respiratory therapists and asthma educators. So there are resources out there that could help you. So I'll gladly talk to you about those as well. Well, thank you. Thank you very much. I appreciate this. And at the end of the PowerPoint's my name and contact information. So if you come across something, I love to get information. Or if you just have any questions further down the line, please contact me. All right? Thank you all very much. Thank you.